time.
Yeah.
It's getting closer.
Yeah, we've been staring at it.
Maybe.
Usually when they make their way in here, they're already dead. That one was alive.
Yeah, you moved from over there.
Catch and release.
Just a way to baby.
All right, so back to here. We've gotten into sideline. Let's say patient started in bed. We get them on their side. There's not enough real estate for me to roll them again. If we're rolling towards us, ideally I could just let her come down into prone, but there's not enough room. So I need to move her away from me right now while she's in sideline. So I'm going to, anytime you walk away from the bed, you're always going to say, or you're always going to bring up, because we're using hospital beds, you're always going to bring the bed rail up. Reason being, if they were to roll into prone or against the bed rail, it's going to stop them from rolling over the floor. Now, even though you have to keep this hand on the patient, okay? So, bed rail is up. I'm going to walk around the bed. Either direction, if you have access to the foot of the bed, you'll do that. If you can't maintain trunk contact with the patient because the bed's too large, we have shorter arms, we have to go this way, and it can't happen, I just want to hear you verbalize. I would have somebody else maintain trunk contact, okay? Reason being, I need to know that you know I'm not just going to walk away like I just did. See the patient in the sideline, right? Okay? So even if we're not able to make it happen in this setting because of limitations, I want to hear you verbalize. I would have a patient or a tech keep their hand on the patient as I walk around the bed before this hand comes up, okay? Hand comes off the patient, you leave them like this while we're chatting about it, it's going to be a ding for points, okay? So you're going to maintain the trunk contact, we're going to walk around. If you're working with a patient, you always have to have the railing down. So you walk to this side, we pulled up that rail, we're going to drop the railings on this side so that I can access the patient, okay? I need to move her towards me so that I can roll her into prone, okay? So in order to do that, I'm going to use, similar to the USA way, I'm going to move her shoulders, her hips, and then her legs, okay? In order for me to move her trunk, I need to get my hand underneath her. Go ahead and keep your balance for a second. I'm just going to take my watch off. Because my arm's going to be going underneath the patient, I'll take my watch off. Okay. So in order to get my arm underneath the patient, we have a shoulder here, it's going to be difficult. I need to have a way to lift up her shoulder. So what that's going to look like is a lateral stance here. I'm going to come around on top of her shoulder. If I am pulling down on her shoulder here, it's going to laterally bend her trunk. That way I can clear that shoulder and get my arm underneath her shoulder to touch the ground. Okay? That's why my stance is lateral. I'm over that superior shoulder and I'm weight shifting to the side. Okay? I'm not in an AP stance and trying to bend her. I'm not AP this way. It's a lateral stance. Those are our two options. We either have an AP stance for movements. Back into the side so you can see. So what I'm saying is I have a lateral stance. Both feet are facing the patient. I'm going to weight shift from this leg, that's where I'm touching the patient, and I'm weight shifting to the side to lift your trunk. That way I can get my arm underneath here. My hand's going to be on the anterior surface of your shoulder. Okay, so AP or lateral stance, we're up over the shoulder, hooking. I'm not just grabbing the top of her shoulder, anyone can see. I'm hooking my forearm around her, more surface area, I've got more control, and then you can help me as much as you can. I'm just gonna get your hair out of the way. Okay, so palm facing down, help me as much as you can. 1, 2, 3, and we're here, okay, and we're here. I'm gonna keep my arms, my top arm where it's at, my feet just switched to a, what stance is this? Okay, I'm gonna move her towards me. Help me as much as you can. 1, 2, 3. Arm out, maintain trunk contact, and we're moving down to the hips. Okay? Let's go back to where you started. I'll do it again. Actually, face the other way. And I'll do it the opposite so you can see.
It was up for
They're falling asleep. Okay, so I need to move her towards me. My stance should be lateral. We call this wrap technique the chicken wing. Okay, so if I say do the chicken wing, this is what I mean. Lateral stance, my stance leg where all my weight is where I'm touching the patient, and then I'm gonna weight shift this way to laterally bend the trunk, just to allow me to get my arm underneath. Okay? Let's say you don't have enough range of motion. Let's put that, you tuck that arm underneath your trunk. So now on that side, let's say we rolled up. She's gonna feel very precarious because she's balancing on her arm. Okay, so I'm here, lateral stance. I'm around her like this, okay? So my forearm is on the front, and my hand is wrapped around the top. That way I can pull, and I'm flexing her trunk, okay? And she can help me as much as she can help me as much as she can. And then my hand is palm down, palm up on her anterior shoulder, okay? You ready? 1, 2, 3, and here. This arm is my arm's gonna stay where they're at. My feet switch to a AP stance, and now it's just moving laterally. She's just in a precarious position.
Yeah, that's awkward.
I'm gonna move her towards me. 1, 2, 3. That's a weight shift. My hands come out. Trunk contact is maintained because she feels like she's gonna fall. Okay. All right, you can take your arm out. Go back to where we were. Okay. Does that make sense to everybody? Chicken wing technique? You're gonna feel awkward. She's gonna feel awkward. But it's a lateral stance. You're up and over the shoulder. You're weight shifting to get your arm underneath. Then you're gonna keep your hands where they're at. Then you're switching your legs. Arms don't do anything new. They stay exactly how they are. That way you have enough control over the patient. If I see you like this, and I'm pulling a load out here, I know you're gonna be using your arms. It's a lot easier body mechanics wise to move a load when we're close to it, right? Lifting something out here is gonna be a lot heavier than lifting it here. Same technique, okay? So we've moved the patient over in bed at the shoulders. USA way, there was 3 different movements. We did shoulders, hips. Hip, there's nothing to chicken wing on. I can't do anything like that, but I have to get a hand underneath her hip. I can't just jam my fingers underneath. It's going to pinch, rub, feel uncomfortable. The patient could break the skin. So what we're gonna do is roll the patient slightly away. Told us we can't roll patients away from us, right? I can't just let her go and roll into prone, but I can do a quarter turn, about halfway this way. I can stick my hand underneath her hip and bring her back onto my hand. Now her hip is sitting in my palm instead of me just jamming it underneath, okay? So I'm rolling away slightly, hand goes underneath, roll her back onto your hand. And again, is this where I want my arms? Is this how I want my arm? Or do I want to be close to the patient? So we're gonna imitate this technique, but we're just gonna be here. So I'm holding my patient with my whole arm. That way my body is close to hers to move her hips towards me, like this, okay? We're gonna move her towards me. 1, 2, 3. And it's a weight shift back. Back to trunk control, because she's still in sideline. With one hand, you can come underneath, and you can move the legs back, okay? Or if it's easier, you can kind of move the bottom leg and top leg, depending on what you need to do. This whole time, I've never lost trunk control, right? Hands always stay on the patient. If I have to take this hand off, I match, okay? So I never just move like this, because there's a momentary lapse in control of the patient, okay? So, she's in sideline. My goal is to get her to prone. I'm gonna raise the bed rails on my side. I'm gonna walk around, okay? I'm gonna have this arm come out here and grab the side of the bed. Can't be here, because I need her to roll and not land on that arm. She's looking the direction we're gonna go. Her leg is already rolled, or like crossed over in the direction we're rolling. My hands are on her bony landmarks, and we're just gonna come down into prone, and I'm just decelerating her. I'm not pulling her, I'm just guiding her down. Yeah, no, keep your head face down. What's the first thing? No, what's the first thing we're gonna look at as soon as we lay a patient prone? Airway, right? Gotta clear the airway. So if she can't rotate her head, I'm gonna clear it for her. I'm gonna raise the bed rail because I'm walking away. She's in prone. If this is where the case ended, I'm gonna help her by bring this arm down into a goalpost position, okay? And then from there, you would use pillows. I'll have to look at the rubric to see if they require you this semester to verbalize pillows, or if that's not an attribute of this, but it is something that we'll cover in some of your future lectures about preventative positioning, okay? But airway is the first place you have to look as soon as you bring a patient into prone. Okay? Questions?
Can you do that with the arm tucked, the roll apart, so we could see that one?
The roll into prone?
Mhm.
Yes. Do you mind getting back up in the sideline with your arm tucked? Underneath your head?
Under. Sorry.
It's okay.
You bring your shoulders a little bit towards me, like your whole body. Comfortable with that? Yeah. Okay, so we're here, we got her in the sideline. She can still fold the bed. The patient has the ability to. Encourage them to have a hand on the bed so they feel more stable. You're still gonna have trunk control though. So I'm gonna bring the bed rail up, gonna walk around. Okay, she's gonna bring this hand out to the side of the bed. Okay. Legs are where I want them. We're gonna roll down into prone. If her head doesn't already rotate, we're gonna clear the airway and then position her arms. So from here, this arm's close, bed rail is up. To get this arm out, you're gonna come out and down. Make sure you're not trying to move their arm the wrong direction, okay? And then you leave them like this. If they were very cockeyed in bed, I might move her shoulders to the side, go across, move her legs across. I'm never gonna push her away from me, right? So with how she's at right now, she's a little bit close to that side, but I think the most marked thing is where her feet are. So I'm gonna raise the bed rail, gonna come around, and I'm just going to move her legs into the middle, okay? Not gonna be super nitpicky with if she's exactly in the middle and she's not 5 degrees angled off in the bed, okay? It's gonna be understandable, but I can't have the patient with their arm up against the bed rail or up over the bed rail, okay? So, does that make sense? So making sure the patient is generally in the middle of the bed, up where she needs to be in bed, and the bed rails are hitting the patient. Questions?
So what would you do then if they did roll and they were towards the side?
The shoulders?
Yeah.
Okay. Go ahead and move your shoulders a little bit more to the left. Good. Let's say we ended here, and her legs are in a good position, but she's kind of cockeyed. So I would do the USA way. So only thing that needs to move right now, segmentally, is the shoulders. Hips more or less are in line as soon as I bring the shoulders over. Legs are where I want them. So I can't go like this because there's scapula's on the back. What I can do is come across here, anterior aspect of the shoulder, here and here, and she can push, right? As much as the patient can do, so I want her hands up underneath her as best as she can, so that she can push. We're gonna move your trunk towards me. I have an AP stance because I'm moving the patient towards me. Here and here, making sure you're cognizant of where your hands are, okay? And move towards me, 1, 2, 3. And we're just moving her a couple inches over, okay? We are not lifting up, hyperextending the patient and putting them back down. We're just lifting enough to unweight the patient's torso to move them linearly towards me. Okay, good question. All right, any other questions? All right, go ahead and practice supine to sideline.